We'll start recording, and Brian Parrish is going to be our first presenter. Brian, if you don't mind introducing yourselves and self and jumping into the presentation, that would be great. You may be muted, Brian.
Are you seeing the full screen or the split screen of the slide right now?
Full screen looks great.
Okay, looks great. Perfect. I've never been known to be short-winded, guys, so I'm going to jump right in because I will use up 6 minutes and 59 seconds of my time more than likely. But I'm Brian Parrish. I'm a cardiology pharmacotherapist at Houston Methodist Hospital. I'm the inventor of MAPS and the co-innovator of this and one of the co-founders of Salus. So with that, I'm here to talk to you all about the Medication Administration Protection System, also known as MAPS. This is a digital software that we've innovated that's integrated within the electronic medical record with the goal of detecting and preventing medication errors, making hospitals a safer environment. Cleveland Clinic has made safety a priority. Many other institutions, and at Houston Methodist Hospital, Mark Boom came out and said that it's their aspirational goal to be the safest hospital in the world. The current challenge is quite a challenge. Medical errors are the third leading cause of death in the U.S. Medication errors are the most common medical error that exists. Now, on the bottom right of the slide, you can see that it's incredibly expensive. Conservatively, about $21 billion a year is spent on medication errors in the U.S. It also causes a lot of harm, 1.5 million people harmed per year. So it's costly, it's deadly. In light of this, a survey was done, and 95% of hospital executives believe that clinical surveillance improves patient safety. The biggest safety problem is medication errors, and that is their focus moving forward. I've listed for you here the many different types of errors that exist. These are the errors that are driving the harm and the cost currently. This is what MAPS will address. So our mission with MAPS is to reduce the risk of medication errors and improve patient safety. Our goal is a 50 to 80% reduction in medication errors that reach our patients. That's up to 1.2 million less patients harmed per year, with a $16.8 billion a year in savings in the U.S. alone. This is the timeline of the literature when it started in 1999 with the error is human. As we move forward all the way to the right, we see that as of today, medical errors are the third leading cause of death in the U.S., with medication errors being the most common type of error. When you look at our market size, our current focus is on the hospitals. For 6,200 U.S. hospitals, we are an average of about $1 million per year as a SaaS model, so that's a $6.2 billion TAM. Our SAM, if we focus on just the teaching hospitals, there's over 1,000 of those in the U.S., that'd be 1 billion. And if we narrowed it down to the U.S. News and World Report honor roll system, top 165 hospitals, that's 165 million in revenue. Hospitals are our main focus, but drug manufacturers are also in this space, and there are many large companies that are potential acquisition targets, as I've listed here. Life before has been quite the Wild West. As you can see here, this is just a testing environment of Epic. And if you notice down the middle of your screen there, you see the medications, there's no warnings. We have no idea if those medications are safe. So this is what myself and other clinicians have to do every day. Open up a screen with Epic, open up a screen with the drug information resource, and this is quite the tedious back and forth of dosing indications, warnings, contraindications, allergies, monitoring, drug interactions, etc. This back and forth takes a lot of time. It's tedious, it's inconsistent. And these inconsistencies has caused a lot of errors and a lot of problems. So it stopped about 8 years ago and said it's time for a fresh approach. MAPS is basically going to do this for us. I'll skip through the innovation slide and the architectural side for the sake of time. I'm happy to answer any questions on that architecture. We finished our phase 1 successfully. We finished our phase 2 MVP also, and we finished our phase 3 productization without any hiccups. We now have started our company, Salus. We are in our full commercialization phase, and I'm happy to report that we just signed Houston Methodist Hospital's entire hospital system here recently, so it's been an exciting time for us. So this is what it looks like life after. Remember the medications in the center of the screen, there's no warnings. Now you've got the warnings on the right-hand side. This is uniquely embedded and integrated into Epic to reduce alert fatigue and not interrupt the current workflow. This is the view that a physician sees, a nurse practitioner, physician assistant, pharmacist. The other view is what a nurse sees. And what you see here again is very much consistent with the warnings on the side. As we blow up these warnings, you can see here, we include with every warning some verbiage about what that warning is and the severity of it. You hit the acknowledge button. We have pre-built radio buttons with verbiage already in there. And you can also type out your comments of why you're acknowledging this medication. Once acknowledged, it drops down here in the bottom of the screen under Acknowledged Alerts. This is completely customizable for every institution, however they want it. Here's a blown up screen, again, of just executing that. You can see the Acknowledged Alerts. You see here, these are green. The green represents that we have done our analytics, we performed our API calls, we ran everything, all the analysis. There are no errors, no warnings, and this is going to help prevent errors of omission. The yellow is a medium severity warning. It could be drug-drug, dosing, allergies, drug interactions, a number of different things. And then there's also red warnings, which are absolute contraindications. When we look at the competitive field of other clinical surveillance tools, Vigilance, Theradoc, and Mediware exist, but we are incredibly different from these guys, and we're somewhat in a different space. We offer true real-time dynamic alerting systems. The other systems do not. I like to say we're like a video camera. We're always recording and we're always there like a guardian angel. As the patient gets worse, the colors green, yellow, and red will change. But as the patient gets better, those warnings will also change back to yellow or green depending on the severity of the patient case. As you saw, we are seamlessly embedded within Epic to improve the workflow. We also leverage artificial intelligence and machine learning, so we do not rely solely on ICD-10 codes and SNOMED codes. We're able to uniquely pluck the diagnosis and compare drugs with disease for any potential contraindications or warnings. We can customize the rules for each individual specific institution based on their policy, procedures, and initiatives. And we utilize API calls for enhanced accuracy, consistency, and reliability. From a regulatory standpoint, we are currently under United States Patent Office review. We are in non-provisional status. We submitted through NAMSA a 513G to the FDA, and thank God no 510K is required at this point. From a business model perspective, from a revenue model, we are an annual subscription as a service. As I mentioned earlier, we have add-on modules that are institution-specific or even therapeutic area-specific, like oncology or cardiology. We offer multiple flexible plans available for the size of the hospital and their pain points. So I've been mentioning a lot about the customer profile of hospitals, but we are also in potential partnership conversations with medication dispensing device companies and actually pharmaceutical companies as well. Outpatient clinics and pharmacies are also a potential target. Last slide here, I'll end up on a health economic value slide to give you an idea of the impact. If you take a 3,000-bed hospital system like Houston Methodist Hospital, who voluntarily reports about 3,000 medication errors per year, this is published data. Each error is worth $4,300 on average. So that's $12.9 million that this institution would have as a healthcare cost burden per year. Incomes maps, and that's $710 per bed. So for this particular 3,000-bed hospital, that contract would be $2.1 million per year, and that's an annual cost savings of $10.7 million per year. Not only does it save a lot of costs, but we also will reduce harm and help prevent death, and we will improve efficiencies by not stopping the line and reducing alert fatigue by our unique way we are embedded within the electronic medical record system, thus expanding the job duties for existing employees. There are my references, and at this point, I will field any questions you may have.
Brian, thanks a lot. Great. I appreciate it. There are some questions in the chat. First one was from Tim. Does the acknowledgement by the doctors put any liability onto that physician, or is it the patient that acknowledges these interactions?
It is the doctors or pharmacists or nurses, whatever the institution, whoever they want to be in charge of acknowledging. Here at Methodist, it'll be physicians, nurse practitioners, and the clinical pharmacy specialists like Dr. Sukar and myself. The liability is, at this point, we've been through the FDA and our legal is very low based on the fact that we don't give guidance on what to do. We merely report that there's a problem occurring, and we put the problem in front of the clinician, and then the clinician now has the problem and can come up with a solution. When you start offering solutions, for example, if you start saying, this drug should not be used with this drug, I recommend using this drug instead, now you open up a whole nother legal FDA review process.
Thanks. Jared Jeffrey has a few questions. First one was whether or not MAPS leverages the 5 rights of medication administration. Are you familiar with this framework, and is MAPS using that? MAPS
is not specifically using the 5 rights, but we are indirectly using it by we're pulling all of published data and published literature and guidelines and validated and verified drug information resources. We're pulling all of the API calls from Epic, labs, tests, values, diagnoses, et cetera, using artificial intelligence and machine learning to pluck the diagnosis out and compare based on literature what the contraindications have and what exists. So the fact that we don't have to rely on SOMA codes and ICD-10 codes is quite unique. We don't have coded in the 5 rights. That's something certainly we can do, though.
Thanks. Suzanne Richens says, is there a sliding scale cost based on bed size?
Yes, we are $710 per bed. So a hospital that has 30 beds will pay 30 times $710 per year. So Houston Methodist is around 3,000 beds. So Houston Methodist contract looks like 3,000 beds times 710. Obviously, that's the market value of us, in negotiations there. Yeah, so the price is tiered off based on bed and hospital size.
Another question from Tim about the kind of liability for the doctors. Now that you are letting the doctors know that something's wrong and the doctor said it was okay, and then the patient is harmed, what does that liability look like for either the doctor or the system there?
Well, clinical decision support tools have been around a long time, and there are other clinical decision support tools out there. We use them every day, like Vigilance, for example. We've used Vigilance here at Methodist I've used it for 18 years. They have a way of showing warnings and stuff as well. The liability has been null. There's been no liability associated with it yet, and no litigation from our perspective of merely reporting that a problem exists. The litigation would obviously come into, does the physician acknowledge it, do something about it or not? Because we're just basically organizing this and presenting this in a unique way and not offering guidance on that, the legal perspective and issues from this are extremely low. And the FDA agrees with that as well.
Thanks, Brian. We've got time for one last question. Anybody want to come off mute and ask about Salus? Any other questions?
Brian,
It does look like a great product.
Thank you.
Brian, there was one question about the error that happened at Vanderbilt where the nurse was, legal action was pursued. Would Salus have caught that error and resolved that issue?
Well, here's some unique ways we're working on that. The answer is yes and no, potentially. Salus is going to catch clinical nature errors, drug-drug interactions, drug disease contraindications, warnings, precautions, adverse events, allergies, et cetera, et cetera. We're currently working on a partnership with a company called IntelliGuard, where we're going to be using their RFID technology. And one of the discussion points is using MAPS technology. If a nurse walks in with the wrong medication, as they walk in the room, the RFID will automatically be transmitted into MAPS, and an alert will pop up in real time saying, you've got the wrong drug in your hand. You need to take a look at what it is. So that is something that we're currently working on. The current state of the union is clinical in nature. If a nurse receives the wrong drug in the wrong bag, that is a technical error, and MAPS does not catch that. But if an order for chemotherapy had been ordered on Taylor, for example, God forbid, it would pick up that as you just enter that in a patient that doesn't have an indication, and it would stop it before the nurse even gets the wrong medication.
Great. Brian, thanks so much for the presentation. Fantastic job. Really appreciate it. If any of you have other questions or would like to follow up with Brian, please connect with him either on LinkedIn or shoot him a DM. Corey, do you mind pulling up your presentation now, and we'll move on to the next presentation. Thanks,
Sure
Brian.
thing. I'm ready to go when you are. I'll share when it reaches that point, but I'll start on video.
Sounds good. You're up. Go ahead. 7 minutes starting.
All right. Okay. Hi, everyone. I'm Corey Kossack. I'm the founder and CEO of Aspireship, and today I'm excited to introduce our latest product, Orchard, to all of you. So over the last 5 years, Aspireship has helped thousands of people transition into new careers that are feeling stuck and overwhelmed in their place in life. And one of the things that really became apparent through that process is just how painful and expensive it is to make a switch much later in life. It can be done. We've helped a lot of people do it. But there's a lot of heartache and not just financial. Hey, someone's a big fan of Aspireship. All right, awesome. And so we really wanted to look at how could we solve this problem earlier in life. In addition, it's pretty well recognized that the education system is not exactly streamlined for the workforce of today. And that's exacerbated now by AI starting to change roles and open up new roles and stuff like that. And so we were looking for a way to really bring the information about what's current and a real window into all of the opportunities that exist in the workforce, not just tech. And so we developed Orchard, which is a brand new platform that we're selling into K-12 workforce development boards, really a number of different areas that have people that need to figure out what they're going to do with their lives and potentially those that are switching as well. So happy to introduce Orchard to you today. And I'm going to share a little trailer to get us started and then dive into some product.
There are few things in life that are as exciting as exploring your career opportunities.
When I'm working with an artist, my main goal is to bring their vision to life.
You are a plumber, but the pipes that you work with have money flowing through them rather than water.
You get to a point in your career where you land at that next step and you're just so enamored.
Walking up 23 flights of steps to watch those levels go up, and you realize just how fast and interesting that construction process really is.
It's a very quick live action process. Every day is changing. It may be the best job you never knew about because I didn't really even know it existed until I found it. And then I wondered, why hadn't I found it 10 years earlier?
If you like uncertainty, if you like that type of challenge, this is a great role for you.
It's just fulfilling for me to be able to get up early in the morning, jump out of bed, literally, and come to work each and every day and serve the patients that need me.
That's incredible. I love that. And I want to work for you now.
All right, so now that hopefully everybody is as excited as I am about Orchard, I'm going to show you a little product. So we have developed a really great interface with short and long form video covering, eventually we'll cover every aspect of the workforce. So we're talking every job, every vertical industry, subspecialty. There's so much nuance to the workforce that people don't understand. And so we've created a great way for both students and career changers to sort of browse that. So if somebody was saying, hey, I'm interested in tech, but I don't really know exactly what I want to do, they can go in and start to browse within here. If they want to just sort of start poking around, I clicked on one here. It's on sales enablement.
What sales enablement is?
And I'm not going to make you watch the full video since we don't have time. But effectively, right from this moment, we start personalizing the experience. So within here, this is all tech. So they're popping between cybersecurity,
There's a couple different ways to come at it.
solutions engineering, many other things. And basically from here, whatever catches someone's eye, they can go in and watch full-length videos, really learning about
Today we have Josh.
Really what it's like to go and do these jobs. And as well as they can dive into the career specifics, stuff you'd expect to see in a platform like this around roles and responsibilities, compensation, the industries that are served, all that kind of stuff. And basically, one of the things that we are working on that we're really excited about is having a way to utilize this and then have people answer kind of questions in real time, sort of like a matching, that gets them narrower and narrower closer to that career that they may not have even thought of, but is really a great fit for them. This is such an important problem in the world, and it's such, not just on a societal level, but from a business impact standpoint. $1 trillion a year is spent on higher education and training towards getting a better career, getting the right career. And it's very clear that we are not quite on the right track just yet. And we're hopeful that we can make a big dent with this. So basically, we are raising some additional money. We've raised $4 million to date since inception of Aspireship. We're raising some additional angel funding to help bring Orchard to market. And anybody that has access to workforce boards, any kind of education systems, really anything, I'm definitely open to all intros and conversations, and appreciate you listening today.
Thanks, Corey. Really appreciate it. Great presentation. Let's see, it looks like Alan just threw a question in the chat. I was a restaurateur, having opened 33 restaurants as well as professional opera singer. I transitioned to becoming a neuroacoustic scientist, tech CEO 8 years ago. Would Orchard have helped me see such a transition observation?
Yeah, absolutely. I mean, I certainly hope so. So the way in which we're going about it is very different than sort of like college and career readiness systems, that it's pretty easy now to aggregate data on, all occupations and, is this an in-demand career and how much money does this make and stuff like that, what degrees are required, but really feeling what it's like to do these jobs. That's where the behind the curtain and really listening to people really kicks in. And we're not just covering entry-level roles. We're also talking about small business, startups, being in leadership. And so as people reach different points in their career, whether it's sort of continuing to level up or thinking like, hey, I need something new, there's just so much self-exploration that can help get you to that point. So yeah, I would hope so.
Awesome. Thanks, Corey. Anyone else have questions? You can come off mute and ask Corey about Aspireship. Tim, go ahead.
So who's your target buyer here, right? So a lot of big places are using LinkedIn Learning or even Pluralsight, but people just don't use the tools.
Yeah, so in this case, so overall, Aspireship has multiple products, and we have a learning product for employers on the B2B side that's very like tech focused. This product, Orchard, the target is like K-12 schools, but more specifically like middle, high school. Workforce development boards are also a good one. So anyone really that is touching a population, could be career coaches as well. We're selling it through a channel that's helping teachers transition into new roles. So anybody that is exploring new roles, trying to find that pathway to the next step could be a customer for us. And it's subscription-based model to distribute to their users. In terms of the next question, looks like, is it built into any curriculum? So basically it's available for anyone to explore on their own. But part of what we're talking about, like we're talking to a large charter school network that wants to deploy this. And, you can integrate it into CTE curriculum. Guidance counselors can use it as a means to, as they're talking through potential options, have students go away and say, hey, I'm going to go and actually learn about, cybersecurity. If I think cybersecurity is something I want to do, like I'm going to actually absorb that and see, does this really fit with me? And so it's a tool for educators and others to utilize.
Looks like Joel has his hand raised. Go ahead, Joel.
Oh, hi, team. Great platform. Vanessa Perez at Make Utah. I just wanted to see if you were collaborating with Use Science to import in the student aptitude assessment results.
So I'm not yet, but I would love to. And so where we are a bit different than those platforms is we don't really rely on assessments, but rather self-exploration. And we are building the largest and best content library around careers. So our perfect scenario, I have a lot of experience in channel. My last company that was acquired, really was built on channel and integrations. And so I would love to collaborate with a Use Science, with some of the others, in terms of being able to bring our content and our experience to the platform as a complement. Of course, you gotta, see the partners, actually see the light and see that that's the right move for them. But I believe that's the direction it'll go. And if you have contacts at Use Science that might want to talk, I would love to talk.
Yeah, I'll reach out to you offline. I'll get you connected, and yeah, good stuff.
Thank you.
Thanks.
Thank you.
Awesome. Thanks, Corey. Really appreciate it. And if you have contact info or ways to connect with you, please throw those in the chat. Really appreciate it. Thanks for all the questions. All right, let's jump into our next presentation. Arjun, or John, are you ready to share your screen?
All right, is my screen okay? Can you see it?
Yep, looks great.
Perfect. Basically, I was a sales representative selling large warehouse-sized greenhouses. And then I saw a market opportunity for smaller greenhouses. A popular format, a trending format was shipping containers. So I started Vizva AgroTech, and we started distributing shipping container greenhouses. We developed a sales team, and we wanted to distribute these greenhouses across North America for manufacturers, other manufacturers. And then we realized that most of these greenhouses were unprofitable. So then we started developing our own technology in order to automate these greenhouses. So one big problem plaguing the greenhouse industry is the high operational expenses. The biggest cost are the labor costs. The availability of labor is very scarce for greenhouse jobs. It's hard work, and they bring in workers from Mexico, seasonal workers from Mexico. Canada's lost more than $500 million just in lost sales because of labor unavailability. And then this problem is compounded by low birth rate and retiring farm operators. So also another problem is food deserts. Several low-income areas across North America and Europe lack access to fresh foods. Additionally, global food miles. So 20% of all emissions are because of transporting food. And then we are also experiencing lower nutrition in the food from tilling the soils constantly and pumping in fertilizers and pesticides. And then there's more nutrition lost after harvest, and that's when the food gets transported to you. And on top of this, the world is experiencing a reduction in arable land. As you know, and then with erratic climate change patterns, the fires in California and the drought as well. So we need to grow more of our foods in protected environments. So our basic mission is to help secure reliable and sustainable food chain. And we want to do this by making fresh, nutritious, and hyper-local pesticide-free produce affordable and accessible. So our product is where a consumer would walk into the greenhouse and directly purchase the produce that is harvested and packaged on demand. You'll utilize a touch screen similar to what you see in McDonald's or an app, and then robotics and other machinery will cut the plant, harvest it, package it right on demand on site and deliver it to you. So this minimizes the labor costs, maximizes the production. We're automating the growing process right from seed to harvest and packaging. The technology is patent pending in Canada, US, and India. So this gives you an idea what one project could look like. So the projects will be operated remotely, and similar to a vending machine, we'll have someone come in and replenish seeds and fertilizer, whatever the project needs, and maintain it. And we plan to sell freshly harvested leafy greens and herbs, and also incorporate strawberries at a later stage. So basically, we will utilize vertical grow towers, and within a controlled environment, we'll be able to optimize the taste and quality and output. Each unit, shipping container unit, is designed to give an ROI of 2 years. So we chose a shipping container format because we can stack them vertically, horizontally. If there's more demand in a single location, we can add more. Or if there's no demand, if the location is really bad, then we just put it back on the truck and we move it on to the next location. It's easy, so easy to transport. It's durable and it's low cost. So that's why we chose this format, but we are not limited to this format. So one of the things that makes this technology possible is utilizing end-of-arm tooling, a single robotic arm, but different tools at the end of it to perform different functions. So this is an example of a control system where we can control the nutrient delivery and control environments. So this will all be on the cloud, and we'll remotely monitor it and optimize it. And we'll also use visual systems to optimize the plant health as well. So there's several benefits. We can pump in much more nutrients than what you have available. There's a lot of food waste just in transport. And then we use a lot less water because it is a hydroponic system. It's in a controlled environment. And of course, we're going direct to consumers, so we want to put it in parking lots of that's in your neighborhood, in parking lots of grocery stores, in gas stations, whatever is convenient and close to the consumer. So we're trying to eliminate those food miles. So there's a big increasing population as well. So that over the next couple 3 decades, we have to produce more food than what is being consumed by humanity to date. The US market is expected to double the vertical farming market over the next 5 years. So the US is has the biggest compound growth rate in terms of projection, but there's a strong case for global production as well. Like they're amazing. There's amazing demand projected. In terms of our market, there's the total environment agriculture, which is of course massive. Vertical farming is a new niche that's eating into that's occupying more of the world controlled environment agriculture. So it's a new technology that's being developed and optimized. And our serviceable, obtainable market is based on once we begin production in our 2nd year. So our key consumer are basically consumers of local people who have shown interest in organic food, pesticide-free, and locally grown food. They have shown to be more passionate about local production. There's a big correlation between locally grown and organic consumers. And this is a growing trend. And another segment, we're going direct to consumer, but the unsold product is not waste. We can just harvest it and place it in grocery stores. So yeah, so basically we have a 4-month, once we raise our money, we have a 4-month development timeline for our prototype. Then we develop the final product over 1 year. And then we hit profitability once we reach 8 units. And in terms of competition, basically, most of the competition, there's been the vertical they've gone through a big, interesting reshaping the vertical farming industry. A lot of the competition, they didn't have good unit economics, and a lot of businesses have gone bankrupt, or they've had to go restructuring, and so we can. We have a special focus on unit economics right from the design stage, in order to optimize these farms and make these projects successful. So
Arjun,
in terms
thanks so
of our
much.
team, thank you.
Yeah, you're jumping into your Q&A, and we've got a couple of questions in the chat. So one of them was asking about the light source in these units.
We are looking at basically LED light sources, and it's mostly going to be LED light sources. We are exploring transparent, translucent roofs as well, but those might not be optimal in colder environments where insulation would provide more energy savings. And one of the things that has made these projects more cost efficient is the dropping cost of LED lights, and the increasing energy efficiency as well over the past decade.
Great. We've got time for one or two more questions. Spencer's question was whether or not you will have a direct to consumer. He wants to just show up to one of the units and buy his salad from you.
That's great to hear. Yes. So we are in early stages. So we are about 1.5 years basically to the final product, and once we get there, it will be open to consumers for access, direct to consumer. That's right. Yeah.
Awesome. Well, our time's up for today. Arjun, thank you so much for the presentation. If you can put your contact information in the chat, people will be able to reach out to you if they have additional questions. Thank you everybody for joining. If you would like to reach out to any of the presenters, I think all of their contact information is in the chat. Otherwise, you can connect with Hannah and she can get you in touch with them. But thanks so much for joining, and really appreciate your questions and you being here. We'll see you all next week. Same bat time, same bat place.
Thanks Taylor.
You all. Have a good day.
That was awesome.
By the way, Taylor, everybody's welcome at the Gracie's tomorrow night. We're relaunching Slopes SOC after 11 years, and we're going to have socials 4 times a year. And it's got all the usual suspects, Mo Reeder and Rob Bell and everything else. And so it's on Luma. Love to see you too. I'd love to grab you a glass of water or something.
Awesome. Thanks, Joel.
See you, brother. Bye.
Yeah.